I have travel plans. What should I do?
So travel has been coming up a lot because spring break is just around the corner. So anytime somebody asks me a question about travel plans, I say ask yourself 3 questions. Who, why, and where. So who are you that's traveling? Are you a young, healthy person, or are you older, immunocompromised, or have diabetes, or somebody who might be higher risk if you caught this virus? Second question, why? Why are you traveling? Is it critical? Is it for recreation? Is it essential? And can it be postponed? And then the third question is where? Where are you planning to travel to? Are you trying to go outside the country, Japan or South Korea? Or are you trying to go somewhere in the United States? So once you answer those 3 questions, you can then decide how important your travel is, how big your risk is, and whether or not you ought to go.
Who is at higher risk?
So there are certain subsets of individuals that are at higher risk if they contract this virus for having fatal complications. That includes people who are elderly. We usually say over the age of 65, but it's really as you get older, your risk increases more. That also includes people with chronic lung disease like COPD or cystic fibrosis or asthma. It includes people who are immunocompromised or on medications that may be suppressing the immune system. And it also includes people with cardiovascular disease like hypertension and obesity.
What is community spread and why should we care?
What that means is that the virus is spreading easily and sustainably from person to person. So in other words, community spread means that you did not contract the virus by directly going to the source, which is somebody who's tested positive for COVID or going to a place where there's a lot of COVID right now. And the reason that that's important is because it shows that the virus is spreading amongst communities, and it can reflect a really rapid growth in the number of cases that we see.
What's the difference between flu and COVID?
So the important difference between flu and COVID is that flu's been around for a while and COVID-19 is brand new to us. But putting things in perspective, the flu is much more common and actually takes many more lives than we've seen with the COVID. So just this year, we've had over 16,000 flu deaths, including over 100 pediatric deaths. And with COVID, we've seen around the scale of a little over 3,000.
How concerned should I be about the Colorado cases?
What happened yesterday in Colorado with presumed positive cases is not news to us. We were expecting it for a long time. So I like to think of it as we've been practicing with the dress rehearsal up until now, and today is showtime. We have now progressed from talking about the condition to actually dealing with it. But besides that, my level of concern today is not any higher than it was yesterday.
Of course, now we have 5 cases, presumptive positive cases. More testing needs to be done by the CDC, but Denver just announced 2 more cases today, and of course one down in El Paso County just this afternoon. We're working to get more information for our 9 and 10 o'clock news, all of our later newscasts today.
And the expectation that those cases will likely grow.
Yep, absolutely. We have much more.